There are about 1,580 patients hospitalized with COVID-19 throughout our entire Central Florida healthcare system. Dr. Keating, can you help put some context on that number, about 1,580?
Sobering, Tom. The beat goes on, and it's the beat of a war drum. When you and I met here a few weeks ago on July 15th, there were 430 patients in our system. We've tripled that, and it doesn't look like it's slowing down. So the surge continues, and we've got to, blunt that surge. We're in a war, and if you look at it, I read somewhere recently, we've lost more people to COVID than soldiers were lost in the Civil War. The Civil War affected every family in our country, and there's little doubt that there's not a family in this country that's not currently been affected by COVID. So we've got some work to do.
I do want to point out that although we are not wearing our masks right now, we are appropriately socially distanced. We do have our masks here in front of us, and as soon as we're off the air, we'll have those masks back on, and everyone in the room with us has their mask on right now. Dr. Keating, the current surge that began in July, as we just mentioned, has brought record numbers of hospitalizations for adults. What are we seeing when it comes to children?
Well, what's happening in the pediatric world, Tom, it mirrors what's going on in the adult world in hotspots like Central Florida. Right now we have about a dozen children in the hospital, which is our all-time high. And I wish there were none, and there was a time when there was none when we were doing the right things last year. And we were masking and we were socially distancing, we were keeping everybody safe. We've got to get back to that, Tom, because really things really haven't changed. Last week there were 94,000 children positive with COVID. And I'm here to protect the children. That's going to be my message for the remainder of our session here. I appreciate you allowing me to voice those concerns.
How sick are the children who are hospitalized with COVID, and are any of them on a ventilator?
Well, ventilators fortunately are rare, Tom, because I think our team is very adept now at identifying children that might be at risk and treating them accordingly up front to not get to that point in time. But COVID pneumonia is the most common presentation of the disease in children. And as a consequence, many of the children are on supplemental oxygen, for example, and steroids and remdesivir. So, they're sick. And although the dosing might be a little bit less than it is in adults, it's basically very similar treatments.
We know that in rare cases, COVID-19 can cause multi-system inflammatory syndrome in children. First, what is that, and how many cases have we seen at AdventHealth in children?
Well, we've seen many cases, Tom, since the inception of the pandemic in the last 18 months. I think we've had probably well over 60, and they come in waves, just like the COVID itself. And after this spike, it usually occurs about 3 to 4 weeks after an infection, and for some reason, children and adults will have almost a hyperimmune response to the infection, and as a consequence, many different organ systems in the body can be affected, such as the brain, the heart, the lungs, the liver. You can go down the list. We know how to treat it, but it can be quite a serious illness.